Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program.
Hi, I'd like to use a bedpan, please.
Oh, of course.
Great.
To assist a patient with using a bedpan, first provide privacy by closing the bedside curtain or the door to the room. If the bedpan is cold, place it under warm running water for a few seconds. Dry it and cover it with a bedpan cover or towel. With the side rail up on the opposite side of the bed, raise the bed to a comfortable working height. If the patient is mobile in bed and can assist by raising her hips, help her into a supine position and raise the head of the bed 30 to 60 degrees. Lower the top linens so they are out of the way, but do not expose the patient more than needed. Then remove the bedpan cover and place it nearby. After powdering the rim of the bedpan to prevent sticking, instruct the patient to flex her knees and lift her hips. If necessary, place one hand, palm up, under her sacrum to help her lift. With your other hand, slip the bedpan under her with its rim facing the foot of the bed. If you're using a fracture pan, slip it under the patient with the narrow end under her sacrum as her hips are raised. If the patient is immobile or has restricted mobility on the bedpan, lower the head of the bed flat, if medically appropriate, and raise the bed to a good working height.
If you just take your right arm and reach for that bed.
Help the patient roll onto one side with his back towards you. With the open rim of the bedpan facing the foot of the bed, place the pan firmly against his buttocks and push it down toward the mattress. Keeping the bedpan centered under the patient with one hand, place your other hand around his hip and help him roll flat on his back onto the bedpan. Do not force the pan under him. Unless contraindicated, raise the head of the bed 30 to 60 degrees and raise the knee gatch or have the patient bend his knees.
And there's your call light when you're done. And here's your toilet paper.
Thank you.
With the patient comfortably resting on the bedpan, cover her for warmth using the top linens or a bath blanket. Make sure she can easily reach the call light and toilet tissue, and instruct her to wipe from front to back to prevent the transmission of anal bacteria to the urinary tract. Remove your gloves and ensure that the bed is in the lowest position with the side rails up. Now give the patient privacy, but monitor her and respond promptly to her call light. When she signals that she is finished, perform hand hygiene, put on a new pair of gloves, and position the bedside chair near the working side of the bed. Move the top linens aside, and if the patient is able to wipe her own perineal area, ask her if she has done so. If she is mobile in bed, have her flex her knees and lift her buttocks by shifting her weight onto her feet and upper torso. To help her, lift her sacrum with one hand and hold the side of the bedpan with the other. Then remove the pan, put it on the bedpan cover, and place them on the chair. If needed, help her to perform hand hygiene. If the patient is immobile, lower the head of the bed, hold the bedpan steady, and help him roll onto his side and off the bedpan. Remove the pan, place it on a towel or bedpan cover, and put them on the chair. If the patient cannot wipe his own perineal area, clean this area from front to back using toilet tissue or a perineal wipe, and noting the skin integrity in the perineal area. Place the used tissue in the bedpan. Or, if intake and output are being measured, place the tissue in the trash or a biohazard container. If needed, perform perineal hygiene. For either type of patient, place the cover on the bedpan as soon as possible. Change any soiled linens if necessary, and make the patient comfortable. Make sure that the bottom linens are wrinkle-free and that the call light is within the patient's reach.
Okay. I'm going to go and take care of this. If you need anything else,
right.
you know where the call bell is.
Right, thank you so much.
Okay.
As part of follow-up care, look for any abnormalities in the patient's stool and urine. If needed, obtain specimens for testing. Finally, empty the contents of the bedpan into the toilet. Rinse or disinfect the pan and store it according to facility policy. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.